then educate and inspire, and then show them the value. They're motivated if they're showed the value of their care, right? Demonstrate the changes. So that leads to motivation, and motivation lasts longer. The patient will stay longer if they're motivated. Compliance is short-lived.
What does that look like? What's a real example?
So if someone's motivated, they'll stay on for 100 visits.
Okay.
My patient visit average is 100 visits. Why are people coming the 56th and 65th and 190th time? Is they're motivated by something? And I've been able to tap into that, whether it be being able to garden, not being up in a wheelchair, whatever. I understand their motivation and we clarify it, and we always keep that in the forefront versus compliance is short-lived. You got to be compliant while you're in pain. You're out of pain. And then people go out the back door. So I feel I'd rather work with people who are motivated and goal-oriented than people who need to be compliant.
So what would be some of the language you would use? I'm just trying to imagine it if I'm not there. Like I'm sure it's not the only thing you'd say, but what would be an example?
So this morning, for example, the language I use with a new patient starts from the beginning is what's slowing you down, what things that you have to give up. And as they list that, I can't reach here, I can't do that, I can't golf. I'm like, okay, this is going to be on your front of your file. These are things that we want to work towards.
Right.
That alone goes a long way, so that when we get to re-examine the patient or progress examine, whatever, I go, listen, I know you're coming along. How's the golf game? Are you ready to get back in the gym? Just put yourself in as my patient. That means something to you. Taekwondo, jujitsu, those type of things, right? Hiking, kettlebell swings. I know you do those type of exercises. Those things were difficult. They're much easier and you're much more proficient at them. If I'm speaking your language, I believe that you're more motivated to stay on with care. You don't do it in a disingenuous way. Do it because I'm interested and I want to help you reach your goal. Does that make sense?
Yeah.
Yeah.
Absolutely.
I'll tell you another story. I had my associate went away for a vacation. So she left me some of her patients. I saw this lady for the first time. And she mentioned she's gotten quite a bit better. It's been 5-6 visits. Her sciatica is getting better. Pain is coming out of her leg. And she says, what do you think? And I says, well, what do you mean by that? She's like, how am I doing? I'm like, how do you think you're doing? And I'm just nervous that if this doesn't get better, I'm not going to be able to garden. Okay. Do you see how those two questions tell me more? What's going on? I'm not going to be able to garden. I said, are you a big gardener? Huge gardener. I love my flowers and vegetables. And I go, okay, imagine this. You don't take care of this and you don't maintain it. You're going to be staring at your garden from your Chesterfield while you have to pay someone else to do that. And she said, there's no way in hell that's going to happen. I'm 67 years old and I'm way too young to deal with that. And I said, okay, stay on the course of care. I'm taking care of her for the next 2 weeks. I said, I'll see you Thursday. Carly Otway talks to you about maintenance. And I'll do whatever. So that's the type of language, right?
Gotcha.
Tell me where the pain goes. Is it travel here? Less pain is what motivates you. What's your life about? I want to know. It's about gardening. Okay, excellent. And I think there's probably more.